Okay, I'm back. For those of you who are new to watching this vlog, my name is Katie. I had, for lack of a better term, botched cool sculpting, which has resulted in basically my stomach and back being not normal due to getting cool sculpting, which is a fat freezing technology that you can walk into almost any med spa and get. And so I am now going to Colombia to get surgery to help get rid of it. So I've been getting a lot of questions, and I'm going to look down at my notes so that I don't forget anything. But I've been getting a ton of questions about what procedure I'm getting, how I decided what procedure to get, and then how I actually chose a surgeon. And so, first of all, if we're talking about procedure, what I've learned through, and when I say all of this, this has now been years of research, talking to various surgeons and getting their opinions. And this is specifically in the context of PAH, which is the condition that now I have due to cool sculpting. But this would be the same process that you'd likely want to follow anyways, regardless of why you're getting surgery. And so, first of all, when we talk about procedure, there's a few things that we want to talk about. First is goals. The second, like sort of obstacles that you might have in place. And the third is really like skin quality overall, which is really unique to the individual. So the first thing is goals. Depending on what goal you have for your body, the procedure will differ. Example being, if you're getting some sort of a breast lift or breast procedure, and what you want is a lift, what you get will depend on, first of all, you and your body, but then also the type of procedure that you end up getting. So, as in, like, do you get a breast lift? Do you get an implant? Is it a combination? The same would go for a body procedure, which is what I'm looking for. So, am I looking for, I guess, how much aesthetically am I looking to get? What are my objectives in terms of physical appearance? Now, for me, my goal is at a minimum, I just want to get back to the body that I had before. So, without kind of the chunks of like hard tissue, scar tissue, whatever it is. So, I really want to be able to get rid of that. The other thing is that through getting cool sculpting, it's actually stretched my skin. So now not only do I have these kind of hard shelving lumps, but I also have loose skin. So for me, it's really a combination procedure where my goals are A, to get rid of the abnormalities from cool sculpting. And the second thing would be to help deal with the loose skin that I really shouldn't have at my age, so I'm early 30s and have not had children yet. So I really just want to get back to a place that I was before. The second thing in terms of choosing procedure is really the obstacles that are in place. And so when I say obstacles, there's a few different things. For me, this is not my first procedure, being that the tissue is not virgin tissue. So I have obstacles being that the tissue is quite scarred. Surgeons will tell you, if you haven't had anything done before, and let's say you're trying to take out fat should actually come out, they say, like butter, like melted butter. It should really come out easily. Now, because of the cool sculpting procedure that I got, that is not what my tissue is like anymore. So that is a really true obstacle that I have to think about when I talk about what procedure I'm going to get. So a simple liposuction procedure will not solve the issue that I have, which is too bad. Other obstacles that I know a lot of women have, it could be hernias, it could be abdominal separation. There can be a lot of different things that women have, and that's going to determine what procedure they're going to get. There are certain things like hernias, like abdominal wall separation, that can only actually be dealt or that can only be fixed with a tummy tuck procedure. So it really depends. Some of this, even post children, some of these types of things, a tummy tuck is actually kind of putting someone's body back together, for lack of a better way of saying it. But that is the procedure that someone might need. And then the third thing, specifically when we're talking about body work that a lot of surgeons talk about, is skin quality. So let's say, you have someone who's maybe a little bit overweight. They get a lot of fat taken out. Depending on how good of skin quality they have, it might retract or they might end up with loose skin. So that's like a really important thing to keep in mind. And so when I'm thinking about a procedure, like I said, there's definitely a thought around just getting the lumps kind of taken out. But then, as I mentioned, cool sculpting really stretched my skin as well. So I'd be left then with quite a bit of loose skin. So the procedure that I am having it's called liposuction 360. So that's around my entire torso. And I can talk like a little bit more about what type of liposuction it is, because that's a whole other story. But basically I had, those are the areas that I had cool sculpting. So I will get liposuction all around there. And then the other thing that I'm getting is a tummy tuck. And the tummy tuck is specifically to deal with the excess skin that is now there from my skin being stretched, from being sucked into the cool sculpting vacuum. So I will have two things done at the same time. It's quite invasive. I can talk more about that procedure. But yeah, it's quite invasive. So, but that's what I'm having. So it's liposuction and a tummy tuck. And yeah. So the other questions that I've been getting are around surgeons and how to pick a surgeon. So this is another thing that has taken so much time, like researching, and I've actually spent hours on the phone and video conversation or video consults with a number of different surgeons. So there's a lot to think about. One of the first and foremost, one thing we want to look at is obviously qualifications. So making sure that a surgeon is adequately trained, and obviously that they are licensed to practice medicine, specifically plastic surgery. So qualifications are important in that sense. When I talk about qualifications would be, do they have some sort of special expertise in the procedure that you're looking to get? Now, this is especially important for those of us in Canada because we don't have a surgery culture like Colombia, like Brazil, like even the US. Meaning that a lot of the plastic surgeons that we have access to are more generalists, meaning that they might do face procedures, breast procedure, body procedures, all sorts of different procedures. And the volume of patients that they see is a lot less than in other countries. So when I look for qualifications, I'm also looking for people who have specifically done a lot of cases on in relation to the procedures that I'm looking to have. So that was a big one. The other thing that I look for is, a big one is reviews. So do I know anyone who's gone there? So I want to be able to get testimonials from people who have actually gone to that doctor for the same procedures I'm going to go for, and make sure they had a positive experience. Other places we can look are Real Self. It's a website where a lot of people rate different medical professionals. So that site can be helpful. The other thing that I've done is actually, look on Instagram for people who have posted about the doctor and actually talk to them that way. But really making sure that there are existing reviews, real people that I've talked to who have had the procedure that I'm having. The other thing that has been really helpful for me is actually looking on Instagram to see if other top surgeons follow them. So usually it seems like it's quite a community of some of the best actually like following each other and maybe going to similar conferences where they meet and things like that. Another thing that I look for in terms of making sure that they are top in their game is actually, are they a surgeon that travels around and actually participates in international professional development, but then also do they educate other surgeons? So there are definitely surgeons that I'm following that will travel to other countries, other cities, and provide education on the type of procedures that I'm looking for and teach different techniques to different surgeons across the world. Now, that's the kind of doctor that I want to work with. Aside from qualifications, the other thing that is really important is that we understand what tools they have in their toolkit. And when I say that, I alluded to the fact before that there are many different types of liposuction. There's also many different techniques of doing liposuction, tummy tucks, and things like that. 90% of the time, a Canadian tummy tuck is not going to look like a tummy tuck that you're going to get by a surgeon in Colombia, and there's reasons why. So tools specific to my condition, I need a liposuction that is quite invasive. It's called vaser liposuction. So it's quite invasive, and we need that because what it's actually going to do is break down that really hard scar tissue or what scar tissue and fat, whatever it is, that's now like basically like hard lumps. So they need to have a technology like vaser liposuction, and they also, I should say, have to have the experience of having dealt specifically with PAH before. So vaser liposuction is one thing. The other thing that I've learned is that there are really good skin tightening tools as well that no surgeon that I've talked to in Canada has used before, maybe one in Toronto. And so there are actually skin tightening tools that can go along with liposuction or other procedures to tighten and improve the quality of skin at the same time. And the skin tightening is actually done underneath the skin. It's not a surface level skin tightening technique. And so that is, it's called J-plasma. There's another name for it as well, but not all surgeons use that. The other tools are, or I should say, it's really around technique. And so there are some surgeons who I talk to in Canada who won't even do liposuction because it's such an art, or they're scared of just doing liposuction. So it's really an art in terms of how you take out fat, where you take it out, but also leaving the right amount so that it looks natural. So there are different techniques, and people get that from doing a lot of repetitions. There's also a lot of doctors who will, be able to give you a more athletic look, give you certain lines that are a little bit more aesthetic for a stomach, things like that. Another huge thing around technique, specifically as we're talking about a tummy tuck, is how does somebody deal with the scar? So it can be a pretty big scar, but are their scars really thin? Do they heal really well? The other thing is, part of a tummy tuck is you get a new belly button. So how are their belly buttons? Do they look natural? Otherwise, it's a pretty dead giveaway that you've had a tummy tuck. The other thing around technique is you see a lot of these surgeons, at least the ones who do really aesthetically pleasing tummy tucks, they don't just tighten the skin. Again, they combine it with liposuction to make it look aesthetically pleasing, but then they're also going to tighten the abdominal walls, which especially after things like pregnancy can become quite loose or separated. And so they will actually manually tighten your abdominal walls, which can do a lot of things, but really obviously have like a really nice aesthetic look to it. So there's a lot of different techniques that people will use. The other thing I should say around technique is that some of these doctors, the way in which and the areas and how they take out fat can accentuate your natural curves. So you don't necessarily, maybe it's, taking a little bit more fat out of your lower back will make your butt look really good, and maybe accentuate it a little bit without putting, having a BBL or something like that. So then the next thing is experience that I look for. And the experience is, like I had mentioned before, how many cases do they see? How many bodies do they operate on? How many times a week are they doing liposuction tummy tucks? I would say the same thing if I was getting something else done, whether it's to my breasts, my face, whatever it is. How many times has this person done it? And so that is kind of goes to the experience. It was extra tough for me because I needed surgeons who have experience in PAH. So they know how aggressive they actually have to treat the PAH so that it goes away, stays away. Otherwise, other surgeons will actually see it. And this has happened to me because Cool Sculpting already paid for a liposuction that didn't work. Is that they say, oh, it's not virgin tissue. This is really hard for me. It's really hard to see good results. We're going to try to do something, but this was the best we could do. And so we actually need somebody who has had experience dealing with non-virgin tissue. And so that is actually quite hard to find, and it's hard to find someone who has done it successfully. So just because someone has done it before doesn't mean that they're actually like doing it well. The other things that I look for are recovery. So what do the surgeons recommend in terms of recovery? It's interesting because no surgeon in Canada before has talked about post-recovery massages, lymphatic drainage, and things like that. So there is a lot of research, and a lot of surgeons will talk about this, that a proper recovery is really important to having the results that you want to have. And so it's quite shocking and disappointing in the past that other surgeons haven't maybe educated me or other patients in the same way so that you can optimize results. So I was looking for a place that made sure that that was all at my fingertips in a way that was going to be easy. And so part of what I ended up just picking was a surgery recovery house that is affiliated with the surgeon that I've chosen. And that recovery house will have me 2 weeks after my surgery, where I have 24-hour nurse support. There is a chef that cooks nutritious meals. We have access to, Wi-Fi, TV, all of that. Other women stay in the house as well so that, you're not alone. Luckily, I have my mom that's coming as well, so she will be able to stay at the recovery house with me. But if I was going alone, which a lot of women do, that there will be other women there who are going through something similar to you. The other thing that they have is people that come in to do your massages, and they have transport to bring you back and forth from any medical appointments that you have. They also organize pre-surgery to pick you up from the airport, to accompany you to any of the blood work appointments and things like that pre-op. So it's really an all-inclusive experience that makes it so that you don't have to think about anything but being there and recovering. And then they prep you as well for once you go home, what are the sort of things that you need to do. So maintaining certain massages, how often do you, or what type of compression garments are you wearing for how long, all of that. So it's really important to have that recovery in place. The other thing that obviously we have to think about are price and location. So what's interesting is that after doing all of this research, I came across a few doctors that I was really excited about working with. A number of them, 2 of them were in California, and there were definitely more in Colombia, but I knew of one that I really knew and trusted in Cartagena. So it's not to say they're the only ones, but they're the ones that I really looked into. I spent a lot of time talking to. Their teams were awesome. And price was a big consideration, though, because Canadian dollar to US dollar, not great right now. I don't know if Cool Sculpting is going to pay for this procedure. I really hope they do. But I have to be prepared to pay for it on my own. So I had 2 quotes come in from the US. Both of those quotes were over $30,000. Now, this does not mean that everyone's liposuction or tummy tuck will be this amount. But as I mentioned, the price goes up because I don't have virgin tissue, because the tissue has been scarred. It's been manipulated already. So my case is not the easiest case. But either way, the cost to go to these clinics was huge and did not include things like recovery houses. Your stay in California, or there's a lot of surgeons in Texas too, but it didn't include all of those things. So coming out of it, I was probably going to end up with having to spend $50,000 US dollars on these procedures. Again, these were my quotes on my case specifically. And the quotes that I got for the all-inclusive medical tourism packages in Colombia were significantly lower. And so I will end up paying, I think it's around 10,000 US dollars, and that includes everything. So you can see that that is a huge difference in cost. And that is for like a top surgeon in Colombia. And so the next thing was location. I think it's really tough. Again, being that Canada does not have a surgery culture like other countries. And although it would be amazing to have it done and heal at home in Canada and heal at home maybe with family here, that's just not an option in terms of getting the quality of surgery that I need. And to be honest, I don't know if I would consider it for any sort of future surgeries. And so then the location is, do you choose the US or another country that feels like, it's pretty scary to be going to another country, especially somewhere that is not North America for surgery. But as I mentioned, I did a ton of research. I actually have a family member who has gone to the surgeon, luckily. And then I've talked, as I mentioned, to a lot of other people about it as well. So I'm feeling confident with the research that I've done. And so, as I mentioned, I'm going for a tummy tuck and lipo 360 in Cartagena, Colombia. And my surgeon will be Dr. Christian Montez. And I am staying in the recovery house that's called Balls Plastic Surgery. And so I will tag them down below in the notes. But I highly recommend, if you're considering it, that you look at options like Christian Montez and Balls. Other than that, though, that's just a little bit about how I determined, or I decided with my surgeons, on what procedure to get, as well as how I actually decided what surgeon to use. So I hope that's helpful. If you have any questions, please post below, and I will continue to document based on questions that I get.